Some people stitch and, I make a slightly bigger incision. You don't need to. I just make a puncture wound. Skin stretches, so I stretch the skin a little bit. That allows the IV to go in. So it's basically without any scar. Now this is, we just got this Friday. We do a lot of these things. I just got it for this talk. This is basically showing USGS. And that vein that you looked at was caused by this vein here. So with an ultrasound, we're looking at it. The skin is here. There's a little fat. This is a needle coming right into it, and the ultrasound guidance. This is a USGS, ultrasound-guided sclerotherapy. And the foam that we inject is shiny. You can see it. And as I'm injecting it, unfortunately, by the time I decided to take this picture, I'd run out of juice. So this whole thing would just vanish. It would have been a very impressive picture. So hopefully next time we can show it. But you can all see how it's disappearing here. You see all the foam going through. This is all this is fed through a feeder, and that's what I did. We injected that, and then after I've done this, did I jump one? Yes. Then we do a sclero. So over that, I get this is a 31 gauge needle, and it's 0.25 cc's of sodium tetraethyl, and we gradually just inject some of these things here. It's really, I think most mosquitoes will wish they had something that is small. But it honestly it's very small, a 31 gauge needle. So, and you notice there's a lot of hands in there. I need a lot of help whenever I'm doing something. I guess I must be handicapped, but I think it's very important to put pressure on it straight away. If you don't put pressure on it straight away, you get a little bit of old blood accumulate, then you get pigmentation. So we've had a very good result with that because we apply pressure. And this is the next slide there. You can see pretty much that whole area disappeared. Then what you can't hear on this video is that I said what you need next is a tincture of time. People forget the tincture of time. You need a little bit of time. See this patient back in a few weeks. There's nothing there. This is some of our before and after pictures. Again, this is still fresh. You give it time. There it is. It's totally gone. This is again some of the before and after pictures. Patients like this come and see me and say, "Doc, I know there's nothing you can do for these old legs. There's something to be done for everybody. You need treatment." You can see before and after. Now, phlebectomy, I don't do that anymore. Phlebectomy is basically, we used to make really tiny, tiny nicks and then use a crochet hook to tease the vein out. The problem is, with all of those, I've noticed there's recurrence is high. It was kind of painful doing it. They got a fair amount of bruising and pigmentation. And there's something about the vein wall when you cut it. I don't know what kind of chemical it releases because you get what we call new vascularization. Neo meaning new, vascularization means forming vessels. So they all used to get, other veins in that area. So I essentially do laser and then foam injection. But this is for the sake of this talk, I put a picture of one I had done myself in 2003. This is before and this is after. This bruising goes away with time, but as you can tell, there's always, you're ripping veins, they hurt. The whole idea was instead of making one big cut and cutting the vein out, just like taking your shoe out of your tennis, getting the lace from your tennis shoe, instead of making one big incision, why couldn't you make 10 tiny ones and use a crochet hook and just get the vein out? And that way, because you've got 10 tiny nicks, they would disappear, and basically you wouldn't have any scar. It works quite well. A lot of people swear by it, but I personally, I think any kind of surgery is better avoided if you can. There's some of the before and after pictures. I'm going to go through these very fast. This is a very young lady. When she runs, this leg used to touch the other leg and it used to really hurt. And this is the same left leg. She's very young, actually. She's, 21 25, 26. Yeah, very young. This is after. This is before. Again, after. And you can see there's basically no scar there. When I used to do a lot of aneurysms and abdominal perineal resection, I still do it. And the only thing I thought when I was just doing venous disease, I thought, you know, it would be not as exciting, not as much, you know, taking care of somebody's ruptured aneurysm was a big deal. But honestly, seeing these patients, knowing that, I mean, anybody can do an aneurysm, anybody can do a gallbladder, but there's not much technology available to take care of somebody like her without any cut. And she's actually going to Texas now, and she's very happy. So that her leg is cured. This is the back of her leg. This next slide, we call it the vein. John and I have got our own names for these things. This gentleman is an elderly gentleman who, when he was referred to me when I was in Wallace, I thought they were kidding. They wanted me to take care of it, but it took us a lot of work. But for those of you who think varicose veins is not a progressive disease, you're wrong. It's a progressive disease. I recently found that it was passed through your father. It's an autosomal dominant. And when men get it, they get it younger and the veins are a lot larger. And that is true, actually. I've noticed that. So I don't think many people would tackle this, and I think I must have been crazy the day when I decided to tackle it, but you know, you've got to take care of patients after all. So the options, if you wanted to cut this vein out, you would lose a lot of blood in the operating room, you know, but just crazy. And it's an elderly gentleman, so I don't think it would tolerate general anesthesia. This is a vein right here bulging out. This is the long saphenous vein, and this is all fed through that. So this is the tree trunk, and these are all the branches. Okay. This is after. Okay. Now you can see all the battle marks. You know, you see all the staining. That will all go away. With time, it will go away. So you basically take care of it and sit back. This is another picture. The reason I'm showing this picture is, see that aneurysm there? It's gone. When I just came back from New York, there was a gentleman from Italy who didn't make the flight, but he was going to show a slide about how he would take care of a venous aneurysm, which is that big one is a venous aneurysm. And so he couldn't do it, so he sent somebody else to show this, the video. They made a huge incision, got that vein out, cut the vein, then put the laser inside. And it's crazy. I went to the guy who was actually putting the lecture together. I said, listen, I take care of these things all the time. I never have to cut them. I said, you know, you just go in there, laser it, it dries up, put the pressure on it. And if you have a little bit of blood accumulation, you can always drain it. Excuse the expression, but it's like draining a zit. You know, if the blood accumulates there, just touch it with a tiny needle, and you can squeeze the blood out of it, and it clears up. You notice the lady I just did, there's not any scar on her leg. So this is, again, before and after. Okay? And you see the date on it, 5/29. This is, again, same patient, before and after. These are some more that, what I'd like you to do is just also concentrate on the size of the leg. Because if you measured any area here, you find that this leg is a little smaller than this one. And the skin coloration, you get what we call lipodermosclerosis. Lipo means fat, dermo means the skin, and sclerosis means a scarring off. So these patients get a scarring of the leg, and I'm sure you've seen some of your patients have this black skin. That's notorious. That's just classic for venous disease. Arterial disease doesn't do that. As you take care of this, the skin gradually lightens up, and the texture gets back to normal. I thought you were arresting the disease. You're not. You're actually reverting it back. The way I see it in my mind, if you have venous disease insufficiency when you are 17, 18, 19, believe me, that's when it starts. And over time, your leg is continuing to deteriorate. It's so gradual that you kind of get used to it. Now, by the time you're 40 or 30 or 50, you come in to have your vein taken care of. By that time, the leg is horrible. When you close the vein, this starts coming back towards normal. It might take a year to take you back to where you started when you were 18 or 19. So when some patients say, Dr. Gudarji said that he's going to give me 18-year-old legs, I was kidding, but I was also serious, because when they were 18, the leg didn't look this good because they already had signs of venous insufficiency. So legs do age. They look older. In fact, sometimes you look at their legs and look at their face, you think these legs don't belong to this patient. This is again another case. We put the three of them together. Most patients would, most surgeons, I think, when see that, they probably would run away. I should have too. But you can see it's continued to get better. And believe me, this is not a finished product. If you look at the date here, it's 4/9. So we've still got to bring this patient back and see what else we can do to help them out. I'm very dogmatic. I bring them back, I do an ultrasound. My first question is, where does it bother you in your leg? And they say, well, it still hurts a little bit. And it's amazing. When they say it hurts, you do an ultrasound, you find that there's a feeder right there. Sometimes, the vein is already closed, so that's not a problem. And then we treat them. We stop when they are happy and I'm happy, and the ultrasound shows no more, opening. Again, this is before and after. You see the texture of the skin is different. The size of the leg is different. You can see there is this we call some staining. This will go away. I actually have a laser which gets rid of it, but that will go away with time, and most people like to wait for it to go away. Look at the size of the leg. One of my nurses was about my size. We both wore 14 triple E shoes. And for the gentleman here, that's not the kind of shoe you can buy anywhere. So whenever he found a shoe that size, he would buy one for me, or I would buy one for him. And one day he came in after he had very bad varicose veins. He came back after a year. He said, Kamran, look, he put both of his fingers in the back of his leg. He says, my feet have shrunk. So now he had gone back to size 12, and I had nobody else to share shoes with. But literally, the feet shrink too. Now, the foot is not supposed to shrink because the swelling stops at your ankle. So I don't know. I don't know how to explain that. All I can say is some of that edema, I don't think there is a border there that it stops. It says, let's not go to the foot. I'm sure some of that edema goes down. But if I see somebody with foot swelling, I think about lymphedema. I don't think about venous insufficiency. All right. Again, this is another patient. You can see before and after. Before and after. The same thing here. You can see there was some redness there. I've never seen dermatitis, venous dermatitis around here. But he definitely had it. This is a little bit of bruising, but it all vanished. So I don't know. You're not supposed to get venous dermatitis around the groin. And I don't think it was fungal infection because it cleared up after we took care of him. We couldn't, this one here, again, this is before. You can see hyperpigmentation just above the ankle. That's where they usually get it. It's already disappearing. So this caused that. Okay, the vein starts here, goes all the way to the groin. Pressure here has been measured. It's 300 millimeters of mercury. Remember, your blood pressure is only 120. So it's very high pressure. And that's where usually when you see our nurses here, if you see patients with leg ulcers, it's always here because that's the area of highest pressure. That's why when they make these stockings, they make sure the pressure is the highest at the ankle, and it gradually drops as it goes up.